In this video, we will demonstrate how to set the refinement surface and how to perform calibrations for the X-Mark procedure for a fully edentulous jaw. The first step in using the new X-Mark feature is to set the refinement surface in the planning section of the software. This process is necessary to best define patient anatomy and to establish accuracy for X-Mark virtual fiducial touch points, registration, and refinement. To start, click the new Set Refinement icon in the Planning section on the main menu bar. When you first enter this page, the surface anatomy should outline in yellow on the cross-section images. If the surface does not compute, adjust the surface slider in the 3D window until the 3D looks appropriate. Please note that for fine adjustments to the 3D surface rendering, click on either side of the slide tool button instead of dragging the button itself. And if the 3D render displays a lot of scatter, use your lasso clipping tool to clip it out. It may take a few seconds to compute the new adjusted surface. Now notice the yellow outline around the anatomy. Ideally, this outline matches the outer surface of the anatomy. But if not, we will refine it using these easy steps. First, insert 4 control points from left to right on the 3 cross-section images in the upper left-hand panel. The area should encompass all anatomy that may be used during X-Mark and refinement. Extra airspace around the anatomy is acceptable, but the inclusion of excess anatomy or scatter should be avoided. Use a double click to place control points 3 to 4 millimeters distant from the buccal occlusal lingual surface. Notice a resulting panoramic contour rainbow as well as its overlay on the 3D rendering. If there's anatomy protruding out of the rainbow on the 3D rendering, then make adjustments by dragging a control point or points in the cross sections. You can show and hide the contour rainbow to help you determine what should or shouldn't be included. Once this step is finished, you can complete your treatment plan and move on to calibration. After completion of set refinement and treatment plan, we are ready to move to setup and calibration. Calibrations will include both the handpiece and the new X-Mark probe tool. Click on the Select Surgical Instruments icon in the Calibration section of the main menu bar. Click on the probe tool to enable if not already. If you have already learned handpiece calibration, this step remains the same. We calibrate the handpiece by starting with the body and then the calibration disc. In the Calibration section of the menu bar, click Contra-Angle Handpiece. Hold the body of the handpiece under the camera system at 60 to 80 centimeters distance from the camera. Click Start and spin the handpiece. Next, calibrate the handpiece chuck with the calibration disc. Attach the disc to the chuck, attach your motor to the handpiece, and run the motor at 10 to 25 RPMs. Hold at a distance of 60 to 80 centimeters from the camera and click Start. When this is complete, software will auto-advance to calibration of the probe tool. First, assemble the probe tool using the black wrench that is used for handpiece assembly. Calibrate the body the same as you would the handpiece body by spinning under the cameras, again always at 60 to 80 centimeter distance. Software will again auto-advance now to the probe tool pivot. We will use the go plate to calibrate the pivot. The pointer to the probe tool needs to be touching the pivot indentation on the lower right-hand corner of the go plate. It will be important to keep this pointer touching the plate at all times during the calibration of the pivot. Again, hold 60 to 80 centimeters distance from the camera and rotate your wrist as seen in this video during the calibration time. Once calibration is completed, you are now ready to proceed to X-Mark registration. If you have any questions, please do not hesitate to contact technical support.